Good morning everyone. So today we are going to do chapter 13 of your NCERT book. Why do we fall ill? This is a common question that comes to everyone's mind whenever they fall ill. That why only I have fallen ill? Why not the other members? Right? Other members in the family or neighborhood, etc. Why I have fallen ill? Now you have already learned that our body is made up of millions of cells. These cells combine together to form tissues. Then tissues, they make up the organs. Then the organs make the organ system and so on. And for these organ systems to work well, for these cells to work well, we require certain things in our body, right? What are those conditions? So that our cells may work properly, our organ systems may work properly. Because if any of the, all these organ systems are interconnected. And if one organ system fails to work, the whole body systems are disturbed. Right? So that is what we mean by health. And that is like our body system, how it will work. It does not mean only the physical health. Right? This all, the working of the cells, etc. This is connected to the physical health. But what is the actual meaning of being healthy? Healthy doesn't mean that you are strong enough, right? Or you are having a good weight of the body, good growth of the body. That is not what is being healthy. According to WHO, that is World Health Organization, what is the definition for good health? A state of being well enough to function well physically, mentally and socially. Right? There are three things: physical health, mental health and social health. Physical health, of course, if all the body organs, all the cells, everything present in a body is working properly, that is what is meant by physical health. But being physically well only does not mean that you are healthy. You should be healthy mentally also. That is, our mental health should also be good. Mental health means without any stress. We are not in a stress. We are not in any tension. Right? And our mental level, our IQ level, everything is perfect, right? We are able to communicate properly. That is what is meant by mental health. And then comes socially fit. Social health means how we have the relation with our society. That is what, like, if we are not accepted in the society, how can we be healthy? If we are not accepted by the society, our mental level is also not good. All the time we will be in stress, we will be in tension. Right? So, the harmony we have with our society, that also keeps us healthy because we are happy with that. Right? To be healthy, we have to be happy also. So, if we are physically fit, mentally fit and socially fit, we are happy. We are not stressed at all. That gives a good health. Right? That is what is meant by good health. So, there are certain conditions to be necessary, the conditions necessary for good health. What are these these conditions, first is proper nutrition. That is for our physical health. If you are taking proper nutrition means a balanced diet, having everything what is required by our body for the growth, proper growth, etc. Like we include carbohydrates, fats, vitamins, minerals, everything in our diet. That is what is meant by proper nutrition. Then clean food, water and air, very important, because if the food is not clean, it is adulterated, that will lead to ill health of the body. Water is contaminated, it is not pure, that will also lead to certain diseases in the body. Then air, if air is polluted, that will lead to certain malfunctioning of our bodies, of the certain organs, right? Our lungs may not work properly, there may be some health issues because of that. Then proper habits. Proper habits means no to alcohols, drugs, smoking, etc. These should not be in our habits, right? That also, because these may lead to ill health of the body. Then exercise. This is also very important for good health. You can do any exercises you want. You go for yoga, or you go to gym, or you can work out at home. Then proper rest and relaxation of the body. Proper sleeping hours. All these are very important for good health, right? Then now we come to certain factors which are required for individual's health. These are very important factors, because health, it is not only your personal health, it is not related to your personal well-being. It is related to the community also. How it is related? Like, what are the factors for individual's health? First is the physical environment. Physical environment around you, that should be very good. A proper physical environment. Now, this the health of the individual, it will depend on this. That is physical environment. Like during cyclones, during earthquakes, etc. The environment that is disturbed. Or even, these are very big examples, small examples also. The surroundings should be neat and clear. The air should be not polluted. These are all included in the physical environment. Then the social environment, the society around you, where you are living, where you are all the time, that should be very good. If suppose you have the neighbors which are always fighting, the neighbors, maybe someone is drinks all the time and keeps shouting and howling and having fight with others, that will disturb your mental level also, right? That will lead up to tensions. Then public cleanliness, that is at the community level. If there is stagnant water in your lane, or someone, there's a suppose an empty place near your house and everyone goes and drops their they empty their dustbins over there and there is rubbish lying all over, that will lead to so many diseases, right? So public cleanliness, the drains should be properly cleaned all the time at community level. So all these are very important. Then for individual health, good economic conditions and jobs, that are also very important. Why? Because just now I told you, for good health, proper nutrition is required. To buy good food, healthy food, Economic condition should also be good. Then social equality and harmony. That is very, very important. How you live in a society, how you have the harmony with the society. That is very, very, very important, right? So these are certain factors which are very important for an individual's health. Then there is another thing which is required for an individual's health. Now, let's start this first. We are talking about health, and there is one another term called disease. It is the opposite of health, right? Disease. What is the meaning of disease? This word is divided into two. This means you can say no, and ease means comfort. That means when your body is not comfortable, that means you are having a disease. Now, being healthy and being disease free, does that mean the same? Healthy and disease free. Does this word have the same meaning? Disease free means being healthy. No. Health is totally different. As I told you, health means when you are physically, mentally and socially fit. It includes all three factors. Disease means when your body is not at comfort. Not at comfort means, suppose you are having cold and cough, your body is not comfortable, right? But that does not mean that you are not healthy. That doesn't mean that you are not healthy. Or you are having a sore throat. That means your body is not at comfort. But that does not mean that you are not healthy. Right? You are not able to sing properly. You are not able to sing. Your throat is not that good as the other singer. That does not mean that you are not healthy. Right? So there is a difference between being healthy and being disease free. They are totally two different words. Disease means when you're individually, only your physical, you can say, physical health. It is related to physical health. Whereas healthy means, or good health means being in good condition physically, mentally as well as socially. Right? Now, when you are not at comfort or you are suffering from a disease, let's see, what does the disease, how will you come to know whether you have a disease in the body? Right? What does this disease look like? Does it have any appearance? Right? How will you come to know about the disease? So, for this, we are going to learn about two things. One is sign and the other is symptom. Sign and symptoms. So what does a disease look like? Does it have any shape, etc.? Right? So when we say like very normally we say we are having stomach ache. But what does that mean? Stomach ache doesn't mean there will be some disease only in the body. That is not necessary, right? So what do we first see? We see the symptoms, right? That doesn't mean that if you have stomach ache, that will be food poisoning only or something. You never know what may be the reason behind it. You just look for certain symptoms, right? Maybe you are feeling some the problem of acidity, right? A little pain in the stomach. That may be due to certain reason that whatever you have eaten, that has not been digested by the body, right? That is not necessary that it will lead to certain very you can say a condition where you have to be hospitalized. Or suppose you are having headache, right? So just simple, maybe the headache is due to certain stress. You have an exam and you have been studying the whole night. That may lead to headache. It is not necessary that that headache is due to the migraine or anything. These are just the symptoms that you get, right? Symptoms are what you feel like something is wrong in the body, right? Something wrong in the body, but actually you do not know what is that. Something wrong in the body. That is the symptoms that you get. That is at your own individual level. Signs are which can be seen by the others also. Symptoms cannot be seen by others, right? Cannot be seen by others. That is what you are feeling yourself in the body, but others cannot see it. But signs are the things which others can also see, like rashes on the body, right? That can be seen by others also. Or some, you can say, redness in the eyes. That may lead to conjunctivitis, right? So these can be seen by others also. These are the signs which others can also see. Symptoms are what you feel that something is wrong in the body. So when you get these signs, you go to the doctor, and the doctor may have some tests done with your blood, or maybe some x-rays and all that, and then come to a conclusion what the disease is, with which disease you are suffering, right? So this is the difference between symptom and signs. So actually you do not come to know that there is no shape or size of the disease, how the disease look like. You only get the symptoms or the signs of a disease. Then this disease can be for long duration or for short duration, right? On the basis of this, we divide the disease into two types: acute diseases and chronic diseases. Acute and chronic diseases. Acute diseases are for short duration. Short duration, like you get cold and cough, right? For example, cold and cough. Or you get viral fever. So these are for short duration, maybe for a week, 5, 6 or maybe up to 10 days and all. After that, this gets over. But it will not have any, do not have any major effects on the body. Right? It does not have any major effect on the body. While chronic diseases, these are for long duration. Long duration, like cancer, right? AIDS, diabetes, tuberculosis, right? And they, of course, they have major effects on the body. Right? So this is the difference between acute and chronic diseases. Chronic diseases, they may even last for your the whole life, like diabetes, etc., or the AIDS or cancer can be for lifelong. Tuberculosis, of course, can be cured, but it also takes almost 1 year, 9 or 10 months to be cured. So this also takes longer time. That is why it is a chronic disease. And of course, this this have a major effect on your body organs, right? Then why these diseases are caused, or what are the causes of the diseases? This we will take up in the next turn now, in the next video. So this was just an introduction to what is meant by health, what is the meaning of disease, how does the disease look like, or how do you come to know that your body is suffering from a disease. So then, till then, you just keep safe and keep studying. Thank you.